Nice to meet you.
Nice to meet you as well.
What's your name?
Kaylee.
Hi, Kaylee. So what brings you in here today?
I have a really sore throat, and it seems to be swollen, and I don't know why.
Okay. So what we're going to do is I'm going to assess your head, your face, and your neck.
Okay.
Okay? So the first thing I'm going to do is I'm going to inspect your scalp.
Okay.
Or inspect your head, rather. And I'm looking at the size, the shape, and if it's proportionate to your body.
Okay.
So your face shape is good and it's proportionate to your body. And now I'm going to palpate your scalp to make sure there's no bumps or lesions. Just going to work my fingers through her hair. Okay, so I didn't feel any bumps or lesions. And so now I'm going to assess your temporal mandibular joint. Okay, so that's on the side of her face. And to test that, I'm going to go right here, and I'm going to ask you to open and close your mouth. Okay, can you do it again for me? Perfect. Okay, so her joint moved as I asked her to open and close her mouth, so that's good. Okay, so now I'm going to test your face for symmetry. Can you smile for me? Can you frown for me? Can you raise your eyebrows? Perfect. When she smiled and frowned, her lips moved symmetrically, and when I asked her to raise her eyebrows, they also moved symmetrically, so her face is symmetrical. So the next thing I'm going to do is look for any involuntary movements. As I walked in and asked her why she was in here today and how she was doing, and as I started the assessment, I noticed there were no tics or twitching that she was having. So she has no involuntary movements. I'm also going to look for edema in the face, which would be swelling. And as I palpate, I feel no swelling in her face, which shows no presence of edema. I'm also going to check her ears for her edema and her eyes, which there's no swelling, so there's no edema. Okay, and lastly, I'm going to check for lesions on her face, which are any abnormal cuts or abrasions, which there isn't any. Okay, so next I'm going to assess her neck. Okay, so I want to make sure the neck is centered to her body and that it's erect and still, and that the muscles in the neck are symmetrical. So can you stand up for me? Okay, so as she stands up in a relaxed position, I can see that her neck is in the center of her body and that the muscles are symmetrical on either side. Okay, so as I palpate the neck, I do see that there is some swelling going on, as she said when she came in. And it also is symmetrical on either side. Okay, so now I'm going to test your range of motion. Can you touch your chin to your chest? And now can you bring the back of your head and touch your back? Okay, now can you touch your ear to your shoulder without moving your shoulder up? And do the other one for me? Perfect. And now I'm going to have you spin your head all the way around, like in a circular motion. Perfect. So she was able to do those without pain and without any hesitation. So her range of motion is good. Now I'm going to test your lymph nodes. So can I have you sit down? Okay, to test her lymph nodes, I'm going to do both at the same time to see if they're even and symmetrical on either side. I'm going to take 2 fingers and go in circular motions throughout her face and her neck and her chin and her chest. Okay, so I'm going to start right below the ears, okay? And so I'm going to go right here and test her lymph nodes. And I'm going to move my fingers in circular motions right behind her ears to test those nodes as well. So then I'm going to bring my hands back down and test right alongside her chin because there's lymph nodes there as well. There was no swelling in any of those lymph nodes. So I'm going to come back down and check her neck. Okay, as I stop right here, this is where I feel swelling. This is where she came in with her initial complaint of a swollen neck and a sore throat. And this is why. Her lymph nodes are swollen. So I'm going to keep continuing down her neck. Okay, there's also 3 lymph nodes right along her clavicle. So I'm going to test those as well. Move my fingers in circular motion. And there is no swelling there. Okay, so now I'm going to test her trachea. And I go right. Can I have you lift your chin up a little bit? Thank you. Right along the midline of her body, okay? Right here. And I'm going to put 2 fingers on it and go on the side to feel it. Right like this. Okay? And lastly, in this assessment, I'm going to test her thyroid gland. So when I do that, I stand behind the patient and I have them relax. So can you just relax for me? Perfect. Thank you. And I'm going to push my hands against her neck like this. You kind of have to push down hard on the person. I'm going to ask you to drop your chin to your neck and then tilt your head to the right. Okay, and can you tilt a little bit down for me? Okay, perfect. Now I'm going to ask you to swallow. So when she swallowed, I felt her thyroid gland moving. Perfect, thank you. Up and down. And it didn't, when I was touching it, it was smooth. It wasn't like sandpaper. If it had been like sandpaper, then I would have had to I would have had to listen for a bruit. But it wasn't like sandpaper, so it was nice and smooth down, so I don't have to test for that. Okay, so your assessment of your head, face, and neck are complete, and I'm going to talk to the doctor, and he'll be in a moment to treat you for your sore throat.
Thank you.
Okay? Thank you. It was nice meeting you.
Nice to meet you as well.